to say your own experience.
No, even at that age when I gave birth, I think I love the idea of breastfeeding my child. I love it so much that I was seeking this knowledge. Like I went to ask, what are the things I need to do? Please line them out. And I followed them religiously. Friends who wanted to breastfeed, but because of stress, because of trauma, emotional trauma, they couldn't breastfeed.
There's always a solution for, problems. So yeah, we're not leaving it here. No. You know I'm going to do that part. Hi, nutrition champ.
Hi.
The girl again.
Yes.
Jessica.
And Paula Green.
Yes. And of course, we're here on Nutrition Matters. Let's just more about our episode this time around.
You did not even bother to ask me how was my journey.
My sister.
You didn't ask me how my
journey
was going.
You have to use the train this time around.
Train that fell down. You want me to follow it? I followed road.
But generally, train and road, what do you prefer?
Train.
And honestly,
please, we need it back.
Train.
We need it back. We need it back.
I can't wait. I can't wait to even have it get to Kando.
I'm telling you.
So, our people, we're back again.
Yeah.
And on this episode, we're talking about postpartum realities, breastfeeding difficulties. Yeah. We did start from maternal nutrition.
Yeah.
Our first episode. And if you missed that, please just go watch our live on YouTube and do a brief catch up. And then our second episode was on
early initiation
of breastfeeding. So yeah, we recognize and we all keep mentioning that mothers also have difficulties during this early initiation of breastfeeding and their postpartum realities.
It is something that a lot of women subconsciously are aware of, but they don't really know the depth of some of the issues that are associated with postpartum delivery. So we decided to talk about it because it is something that is happening in our current reality, and we want to, shine the light on mothers who have gone through difficulties, during after delivery.
I have met colleagues, and one of my former colleagues and friends too, who's a nutritionist. And when you're looking forward to the fact that we know everything, you have all the information, and you're going to attend to them and keep to them and do them when,
especially after counseling a lot of women.
And all. And I was shocked when she told me she found it very difficult to, adhere to these, key information and key practices that would make breastfeeding, seamless and beautiful. It was so shocking. So it now boils down to the fact that it's not about what you know.
Yeah, it is.
It's about experience.
I'm telling you.
It can be difficult.
And people have different experiences.
Yeah, people do. And one thing that is very important for us to keep hammering out there is that it is possible. And there are ways around those challenges that health workers can help with. And sometimes also knowing, having this information can help you manage it better.
Yeah, so that's why at every time we speak about maternal care, we can never stop emphasizing on a supportive community, a supportive environment, a supportive health system, supportive family system. So you cannot do it alone. It's like one person with multiple people around them supporting the process.
Just reminded me also another, friend who had difficulties and challenges too. It was largely related to workplace. Like they barely gave her up to 3 months.
Can you imagine?
I was like, now they fight for 6 months. Some people are not even, some organizations are not even giving up to 3 months. So that alone, when you get the mother to, resume work, your mindset and a lot of things changes. Remember we always say breastfeeding is an act that is always related to your psychology.
Yeah.
How your mental state, also affects everything about breastfeeding.
Okay, so there are some physical challenges that we want to talk about briefly, just so that we can all have an understanding of these symptoms and know when you need to look for help. You need to, go to the hospital or even try to call some health workers to find out what are the things that you need to do quickly. So number one we have sore or cracked nipples, which can mentally also affect the way the mother breastfeeds the child. It happens most times after delivery. So there are multiple things that lead to it. First is attachment, how the child is attached to the breast. The nipple, how you make sure that the areola is in the mouth of the child, and ensuring that you give adequate time for the child to suckle one breast before you move to the other one. Some mothers will say that the child is not even sucking the breast. As for the breast is full.
That's what the next step it leads to. As we're just talking about crack nipples now, I remember clearly my mom, our last born, yes, I'm an auntie like that. Our last born, I witnessed their birth and, observed. And I remember clearly my mom having cracked nipples at some point, and, how she would cringe from pain and all of that. Girl, I wish because I was a kid anyway, I got no nutrition, give her some information. It was related to improper latching of baby to the nipple. Now I know that, and that leads to the other challenge that a lot of women face, which is breast engorgement. Like she was saying that the breast would become full, and when it's full, for mothers who have breastfed before, at that point it is heavy and painful. They describe, and my really can relate so much to it. Yes, it becomes painful. It's as a result of the cracked nipples and the pain that the mother is going through. She would be finding difficult to, want to breastfeed the child very frequently, and with that, there's a lot of milk clean there, but difficult to let the child have it and suckle.
And do you know the funny part? The moment the breast milk is not out, it starts sending a message that there's nobody to breastfeed. So I start going. Before the mother realized that these are the things I needed to put in place to breastfeed the child, the next is the milk is not enough because it has stayed. It's not secreted.
So that if you have seen the diagram of the breasts,
maybe we'll draw it and bring it.
You see, so there are milk ducts milk is supposed to pass. It's just like what do they call it? Drip, when they put the strip into your vein. At a point there's a clogging, and then the drip is not passing through. It's something like that. So it now leads to the mother having blocked milk ducts, and that again compounds it. The whole challenge. So and it stems from not latching properly,
and this leads to. So these things lead to. It's like they are following each other. It doesn't stop at one. One happens, the next happens, the third happens, and then next we now have mastitis. That is breast infection. And it also is very, very painful. It causes fever. You will hear the the mother saying, if the child touches my body, it's on fire. And then she's having so much pain, so much excruciating pain. So, when you have all these symptoms, the mother starts feeling inefficient. Like, I'm not a good woman. How is it that it's my time that I'm supposed to breastfeed?
Then my gate or something. Then they call it again, something like that. And women. Small something. Small something. So women, they see for this life, and when we say mastitis, you know what it is now. We used to have pictures. Mastitis, you see the breast milk.
We are going to draw pictures in the comment section so that you people can see some of the pictures.
So you see, for women that are very light skinned, they will notice some kind of rash and redness around the breast, and you start wondering, my breast milk spoiled. Can my baby still enjoy good milk? Of course, yes. But there are also ways that these challenges could be resolved. I think there's one more last. So
there's overproduction too.
Even low milk production.
Overproducing milk and not getting the child to suckle. Again, if you had one of our live, like the one on early initiation, Paula specifically was talking about how if that child is not attached within 30 minutes to 1 hour of birth, message is sent to the head that, I mean, this person is not ready to breastfeed. So everything we do is connected to the body, like even breastfeeding. I have an experience of a mother who had even at that age when I gave birth, I think I love the idea of breastfeeding my child. I love it so much that I was seeking this knowledge. Like, I went to ask, what are the things I need to do? Please line them out, and I followed them religiously. Like,
I'm just imagining you.
I was very young. So I followed it religiously. Yes, like Otra. Do you know that there was a health worker sat me down and said, with the way if this girl just cough, you run to the hospital, you are going to put yourself inside financial crisis. Stop it. I didn't want anything to touch that baby. I love the caregiving aspect. But I've also seen my friends. I've seen my friends who wanted to breastfeed, but because of stress, because of trauma, emotional trauma, they couldn't breastfeed. It affected their breastfeeding. In fact, they didn't know there was anything related to why breast milk was not coming out. It was eventually when counseling was done that they discovered that the reason why I'm not breastfeeding efficiently, or I don't have enough milk, I'm not secreting enough milk for my baby, is because there's this emotional trauma that is still built in that is affecting my milk.
I think we would have a session,
we'll bring someone.
Mental health, for maternal mental health.
Yeah,
and so it's very important. So you see, these are challenges, and as we're talking about it, I'm looking at you. You can see me. I'm trying to picture you when you're young already. I'm just thinking, how would my situation be? I'm very optimistic that it will be good.
Yeah,
these are challenges.
Optimal nutrition.
That we have. Yes, because I want to live up to this championship that I have. All right, guys. So this is what we're going to share for today.
Yeah.
Please do put on the comment section your experience.
Tell us your experience.
Yeah.
Share experience. Ask questions.
We will definitely have another episode talking about how we can manage these challenges and experiences. Yeah. There's always a solution for, problems. So yeah, we're not leaving it here. No, we're not leaving it here.
So optimal nutrition,
healthy life for all.
Nutrition matters. See you
next episode.
Please,
if you enjoyed this, don't forget to
give us a like,
share, and if you want to see more, please follow us. We're going to be sharing the insight and receiving questions, responding to gists about optimal nutrition.
Oh, and you can tell us if you want us to talk about something else.
Yeah,
drop us your topic.
We can take that topic.
We can take that topic.
All right, guys.
Thank you.
Bye.